Hi everyone, it's Monique from Exceptional Tuition and Resumes and Exceptional Study Australia. So I thought I would do an impromptu video for all of our nursing clients at the moment and for all the nurses across Australia, as right now I'm very aware that you are in the middle of nursing graduate applications, and I thought it would be really good to give you some tips for your nursing interviews, because I think a lot of nurses are going to be attending Zoom meetings very soon, given the lockdowns. And a lot of nurses are also, if they're not in lockdown, going to be attending interviews in person. So I just wanted to give you maybe some interview example questions to help you along the way, as it's a very exciting time. So first of all, if you've got an interview coming up right now, I wish you a big good luck and congratulations for making your interview, as that is halfway through the process of getting your first nursing position. So for me, coming from a recruiting perspective, I would be looking for a nurse that is truly passionate about their occupation. So as a recruiter, in whichever clinical field you're going for, I would love to see my nurses, when they turn up to interviews, that they really want to be there, that they really would love to be working for the organisation and working for the clinical field. So what I'm going to do is explain to you ways that you can show your passion for the job and for the clinical areas, but also give you a few tips on how to answer questions confidently, okay? Because remember, you're going to be up against many nursing graduates right now, so it's really important to know what you're going to say them with heart, and say them like you mean it, okay? Because this is a competitive field. So first of all, I think one of the most important questions that will ever come to you in your nursing interview is, why did you decide on a career as a nurse? So this kind of question is basically going to ask you to think back to when you first made the decision to become a nurse, and think about what was the core reason that made you become a nurse. Was it something in your family history? Was it seeing someone in your family receiving help in a certain area of nursing? Was it that you always had that passion in your heart to care for others? Did you always have a selfless attitude towards society? Did you always want to give back and make a difference to our world? So this is the kind of answer you need to give when you are answering, why did you decide on a career as a nurse, okay? Because this is your why, this is your purpose of becoming a nurse. Everybody can say that they want to help people, but what is the further reason for you becoming a nurse, okay? So think about that. Why do you love nursing is also another key question that you would need to answer, because as a nurse, there must be an enduring love of the profession, okay? Because nursing is not an easy job. I come from a family of nurses, and I saw it in my family that all the nurses absolutely loved what they did, and it was something that they did every day. They worked long hours, they were around nursing professionals and allied health, and a multidisciplinary team constantly. So you must really love it. So give an answer genuinely from your heart, is why do you love nursing? Okay, another question you may be answering during your interview is, why do you find it rewarding to be a nurse? And again, this is your chance to give your passion response, okay? So is it about being able to care for people during their recovery? Is it about helping people to restore their mental state, their physical state, or any other situation that's brought them to the clinical environment? So why do you find it rewarding? Are you fulfilling a need in your heart as well to be actually a nurse? So what is it rewarding? It's asking basically, what is your genuine connection and that is relating to the nursing profession. Okay, so why do you find, nursing is being humbling and inspiring for you? Okay, so that's another question to consider. As we know, nursing is all about being patient-centered, okay, in the way that you deliver care. So you may have a question that's asked to you that's a little bit off the topic, but it asks you, for example, how do you deal with a patient that is not satisfied with your care? So in this kind of question, what they're asking you to do is to consider your problem solving skills and your customer service skills, okay? Because remember, the patient is the center of all of our decisions, okay? We must have their best interests and their heart at all of our clinical decisions. So how do you answer this question to show that you are customer focused, that you want to resolve the issue or the concern that the patient has? And so how would you deal with this particular question? So a way you could answer would be, as a nurse, I would first acknowledge that my patient is not satisfied with the current care they're receiving. Then I would ask them why. What is the reason why they're not happy? What do you think we can do to help you and to improve your experience as a nurse? And how can we best accommodate your needs? So in this way, you must humble yourself as a nurse and acknowledge that there is an issue, and then allow the patient to talk. For example, that will be a way that you would break down how you would resolve a negative feeling towards care. Obviously, the goal of nurses is to make sure that all of our patients are happy with our care, that they come back to us in the future, that they have a good impression of our organisation, along with our own personal representation as a nurse. But at the end of the day, it's about finding a solution to ensure quality patient-centered care is delivered at all times. Another key question that you'll be asked in any kind of nursing interview is, what is your greatest strength or your greatest skill as a nurse? And this is where you need to answer with confidence what you do best as a nurse, okay? So you may be a nurse that is really people focused. So for you, it's all about giving that exceptional experience as a nurse. Another example may be that you have excellent patient advocacy skills. So for you, you really represent the patient and standing up for patient rights, for example. You may also have something like active listening skills. So you may be able to decipher the core reason why a patient is upset. You may have strong consulting skills. So being able to isolate the issue for the patient. If a patient is behaving in such a way that is contradictory to other nurses, you may be the one that will identify what is really upsetting them. And it may not just be a clinical reason. It might be something else. It might be an emotional reason. It might be that they have a pain that they haven't told someone. So your ability to ask the right questions, to be able to, I guess, get inside the head of a patient, to know them, to build that connection. Another skill you might have is the ability to build rapport and trust with the patient and their family. So tell the interviewer you are good at breaking down the barriers, that you are able to gain immediate trust to allow your patients and your family to open up and talk to you in a very normal person, humanitarian manner, okay? Because sometimes the best nurses are the ones that really think about their patients. They're not only clinically good at their jobs, but they're also very people oriented, and this makes a very valuable nurse, especially if you're dealing with a very high risk situation. So that's the question you'd be asked. What is your greatest skill, or what is your greatest strength as a nurse? So think positively about yourself and answer that question. Another question you might have as a nurse is, how do you deal with a difficult or high stress situation in the nursing environment? So let's be honest, nursing is not an easy job. I was actually in the emergency department myself just the other day as a patient, and I saw the way that the nurses were reacting when critical patients were coming in, and it was definitely a stressful environment for them. And the nurses kept their calm the whole time. They made a list of issues that the patients were experiencing, and they showed focus in this state of emergency. So being able to explain, how do you as a nurse remain composed, how do you remain logical, how do you remain non-emotional when your patients are stressed out and your families are stressed out, how do you deal with a high stress environment, and how do you make sure that everyone is calm or brought back to calmness through your personality, through your problem solving skills, that sort of thing. Okay. Another question is, how or are you able to work effectively with other doctors and nurses? So this kind of question is actually asking you, how do you deal with different personalities in the workplace? How do you deal with more experienced or less experienced nurses? How do you build a comfortable working environment? Because remember, as a graduate nurse, you are the junior, and it's important to accept that, but also to be able to know how will you manage that particular difference in skill set or difference in values as well. So you can answer straight away this sort of question. I enjoy working with a team because I am a very team-oriented person. So for me as a nurse, I obviously humble myself immediately because I am here to learn, but I'm also here to work in collaboration and in cooperation with my team. It's important, obviously, as a nurse to always demonstrate that you are a team player, because no job can be done completely alone when we're in the clinical environment. We need to be able to support one another, to communicate with openness, and ask questions when we don't know the answer to a situation. So it's very important to be able to communicate that to your interviewer, that you are really willing to work as a team player and you're willing to learn from those who also have more experience than you. Okay, another question which you may come across in one of your interviews is, what do you find is the hardest part about being a nurse? So this is a question where you actually get to be really honest that being a nurse is not an easy job. And yeah, it's a question where you're allowed to be vulnerable, because I think when an interviewer can identify that you are connected not only with people around you, but also you're aware of your personal limitations and your self-awareness, this will help them to build you to become the best nurse that you can be. So, for example, you may worry when you are helpless. So you may get into a situation that you've never encountered before as a nurse. So to turn it around, you could say, in a situation that I feel helpless or unable to complete a task on my own, I may seek immediate verbal or written assistance from my senior registered nurses, or from my nursing unit manager, or from my team leader, to help me clarify a situation, help me read information which I'm not sure of, because it's always important to do things correctly and obviously avoid any errors on the job. So being able to ask for help and assistance when you can, being able to ask for mentoring or any kind of support is something that's very common as particularly a nursing graduate, because you're new in the environment. So it's important to acknowledge that, accept it, and seek to always grow personally and professionally. So that will be a question for you. So what is the hardest part about being a nurse? You may have other reasons, but this is your chance to actually show vulnerability and real honesty in your awareness. Another key question that you might be asked is, why are you the best nursing candidate for the job? And this is the question where you need to show that you love nursing, right? Because everybody's coming out of university with a Bachelor of Nursing, or if you're an enrolled nurse, you've got a Diploma of Nursing. But this is where you've got to show that you have something special about you that no one has, okay? So before you do your interviews, I reckon that you should think about your strengths as a nurse and think about the most important thing that you bring to the table as a nurse. So think about, are you an innovative person? Are you maybe a true problem solver? Are you a leader, for example? Is there something that pushes you to become a nurse? So that's what this question is asking for, is what is your unique selling point that is going to make you the absolute best person for the job, okay? So this is where you get to actually throw a little bit of emotion into your response to an interviewer to say you are the best one for the job, because you have the Bachelor of Nursing on the piece of paper, you have all the clinical technical skills, but there's something else about you that makes you a standout, and that's what I need you to communicate when you do your interview, okay? Of why are you the best person for the job? Another question which you will need to answer is, tell me about yourself. And this is where you need to explain about your history as a nurse and why you are a self-starter and why you are motivated. Because being a nurse is really an important job in society. It is probably one of the most valuable occupations, I could say, that will give you a great career, but also a rewarding career that comes with purpose. So when you answer this question, this is where you get to talk about what you actually bring to the job as a whole. So it's basically a question summary about yourself. And this is where you can infuse your history of, what you've studied, what's your career background prior to graduation, but also maybe a little bit about your family. Like if you come from a family of nurses, that shows there's a history of people that love nursing. So you can say these kind of things. Again, you can re-emphasize why you want to be a nurse in this particular question. You could mention your long-term ambitions in the clinical fields. So for example, do you wish to become a nursing leader, or do you wish to specialize in certain areas? Because this is your key summary. This is basically like your career objective in your resume, okay? So don't be afraid to give a quick snapshot of your intentions as a nurse. So I would say that would be my there's 9 questions for you, and then there's other questions which you may like to also consider when you're in your interview. So the most important one will be, why would you like to work for our organization? And this is where you need to know your employer completely, okay? So you need to make sure that before you walk into that interview, that you have read everything you can about the organization you're going for. Read the about us, the values. Maybe if you can get a hold of the strategic plan section of the organization, and maybe if there's a summary of the specialties that the hospital or the healthcare organisation that you're applying for has, and just commit that to your mind so that you know who you're working for. Because when you answer this question, why do you want to work here? This is when you need to show your understanding of the organisation. So what is their key values? What's their vision? What's their mission? What is their purpose as an organisation? And you want to align yourself as a nurse so that you can show that you are a great organisational fit for the organisation, okay? You want to show that you have the values, you have the personality, and you have the service orientation to match that organisation which you are targeting, okay? So, for example, you may love to work for a certain hospital because they are renowned for emerging technology and innovative practices. Or maybe they might be a hospital that's known for their education and their tertiary development of their new nurses. Maybe they're a hospital that has been recently updated. Whatever the exciting part of that hospital is, you should include that in your answer and say why it excites you to work for them. And then you should also incorporate how you know their values and how you match their values, okay? And that'll answer why do you want to work here. So I hope that gives you a nice little set of questions to think about today for your future nursing interviews, because being a nurse is a wonderful career. It's a career that's always going to be around and it's always going to grow, and I really congratulate you once you get to the interview stage, as that is halfway through the recruitment process. And if you need any one-on-one interview training, please feel free to contact either of our companies at Exceptional Tuition and Resumes or Exceptional Study Australia. But till then, I wish you all the very best in your nursing graduate applications this year. And I wish you all the best in your interviews. And I will hopefully do another video for you to help you with your future interviews as a graduate nurse. So thanks everybody, and goodbye from Exceptional. Cheers.